Hello, my name is Aditya Shirali, and I'm an assistant professor of surgery and endocrine surgeon at the University of Florida College of Medicine. I want to extend my deepest thanks to the Thyroid Cancer Survivors Association and their donors, and the American Thyroid Association for supporting my project titled Characterizing Age-Related Differences in the Tumor Immune Microenvironment in Papillary Thyroid Cancer of the Older Adult. Older thyroid cancer patients are more likely to die from their disease, irrespective of disease stage. While the exact cause of this age-induced increased risk of mortality is not known, an understudied contribution associated with this phenomenon may be a biologic change due to aging, allowing enhanced tumor progression. Aging of the thyroid is associated with changes in its metabolism, immune cell recruitment, and an increase in aged and dysfunctional cells within the thyroid. The focus of our investigation is on the detrimental immune modulation of the thyroid. Important immunological factors involved in age-induced tumor progression include the establishment of a chronic pro-inflammatory state in the thyroid known as inflammaging, changes in the immune cell composition due to age, and age-induced changes in the function of the immune cells. The overall objective of this proposal is to examine each of these age-specific differences in papillary thyroid cancer to provide insight into future therapeutic targets to treat older adult patients. Our central hypothesis is that age-specific changes in immune modulation lead to changes in the papillary thyroid cancer cellular environment that lead to more aggressive disease in the older adult population. We propose three aims to examine inflammaging, changes in immune cell composition, and changes in immune cell function that leverage bioinformatics and computational biology. In the first aim, we seek to identify age-specific differences in pro-inflammatory molecules in the tumors, such as growth factors and factors that attract immune cells. We plan to use the Cancer Genome Atlas, a collection of over 500 samples of papillary thyroid cancer, to examine differences in these pro-inflammatory molecules with age. We will then compare these findings with the pro-inflammatory molecules identified in the tumors of our own patients. In the second aim, we seek to identify age-specific differences in the immune cells of the tumors. We plan to use computational biology to identify the immune cells from the Cancer Genome Atlas data and examine how age leads to changes in the immune cell composition. We will then compare these findings with the immune cells identified from the tumors of our own patients. And finally, we plan to use single-cell RNA sequencing, an advanced bioinformatics tool that separates molecular data at the cellular level to identify how age-specific changes in the molecular output of individual cells, such as immune cells, blood cells, and fibroblasts, can lead to tumor progression. In summary, we propose to examine how changes in aging biology can lead to the progression of disease in papillary thyroid cancer. This is particularly important in older patients who have compromised outcomes after being diagnosed with papillary thyroid cancer. Despite this, the treatment for papillary thyroid cancer remains age agnostic, with little investigation of treatment options personalized to the older adult. We hope that these studies serve as a foundation to identify personalized therapeutic strategies for older adult patients with more aggressive disease. Thank you to ThyCa and their donors and the American Thyroid Association for supporting this research and helping us better understand this disease in our aging population.